Hi, thank you for your interest in joining us for the Canvas Clutter Hoarding Project 2012. This project is carried out by Hartford Partnership Program for Aging Education Fellows in University of Pittsburgh to bring awareness, understanding, and insights about hoarding issue in aging population in the community with the help of a local artist's unlimited creativity. Hppae program is a national program working for the excellence of social work and gerontology. This PowerPoint is made to give you a general idea about hoarding and some stepping stones towards your art piece. Pathological compulsive hoarding is a specific type of behavior that characterized by acquiring and failing to throw out a large number of items that would appear to have little or no value to others, for example papers, notes, flyers, newspapers, and clothes, which will cause severe cluttering of the person's home so that it is no longer able to function as a viable living space and significant distress or impairment of work or social life.
In the next 3 slides, you will see examples of the Clutter Image Rating Scale. The Clutter Image Rating Scale was created by Randy O. Frost, a well-known hoarding specialist. This scale was made to help people visually recognize a hoard. These pictures will hopefully be able to further your understanding of what hoarding may look like. The picture on this slide shows what hoarding may look like in a bedroom, from picture 1 being a normal bedroom to picture 9 being a severe hoarding bedroom. As you can see, clothing, garbage, food, collections, and more may comprise a hoard. This slide shows an example of different stages of hoarding within a living room. Picture 1 being completely without hoarding to picture 9 severe hoarding. Notice how the room becomes less and less usable until it is completely unusable in picture 6. Even after a room isn't usable, a hoard can continue to beyond picture 9, where the hoard touches the ceiling. Lastly, we have a clutter image rating scale for a kitchen. Picture 1 being no hoard to picture 9 being a severe hoard. Did any of the pictures from the clutter image rating scale look familiar? Seeing where you fit in the scale may help when creating your artwork for the Canvassing Clutter project. This slide contains links where more pictures and information are available that may be helpful to reference while creating your project. So feel free to explore and reflect. Next, we'll be talking about current media depiction of hoarding.
Today's media is full of various depictions of hoarding in society. Over the past couple years, the issue has certainly been brought to light, which is helpful in raising awareness in the general public. There are television shows on TLC, A&E, and even Animal Planet depicting various hoarding situations that different individuals are willing to share with society. While these shows have helped to bring hoarding into a greater focus by society, the shows have also led to some misconceptions about hoarding. Many of the popular television shows depict a professional who works with a hoarder to try to decrease their possessions. The episode often has a timeline of about a week where the individual must decrease the clutter to either comply with the legal system or with the family and friends' expectations. For many, if not most of the individuals who could be classified as hoarders, a week to part with a substantial amount of their possessions would not be long enough. The individual must be actively involved in every decision that is made about keeping or throwing out a belonging so that the individual can take ownership of the decisions. So having only a week to go through everything would be extremely difficult. The television shows often end with the professional and the family members just throwing items out without consulting the hoarder. Usually when the television shows end, the house and property look orderly and clean. This leaves the viewer to believe that from that moment on, the individual will keep the house clean and clutter-free with no further struggle to compulsively collect items. This is somewhat unrealistic, as the individuals that are featured never receive any psychiatric counseling during the show. This is an example of dealing with the result of their problem instead of focusing on the actual issue at hand. The compulsion to collect massive amounts of objects or pets is a mental process, and that process must be addressed for the individual to change their living conditions. So, in a sense, the reality television shows are setting a somewhat unrealistic picture of hoarding across all of the lifespans.
You are probably wondering, why older adults? In the next few minutes, I'm going to focus on the reasons why we chose to look at hoarding in the older adult population. The first area is loss. Older adults in general experience more loss due to aging than younger counterparts. Many older adults experience the death of loved ones and friends, retirement, loss of job and role in society, and diminished health. Such trauma and stressful life events may trigger hoarding behavior, especially in people with a predisposition to hoarding behavior from a young age. The second area is mobility. Cluttered homes can be particularly dangerous for frail older adults with mobility issues. Many rely on walkers and canes due to unsteady gait, arthritis, and other medical conditions. Many older adults are susceptible to falls, and unlike younger adults, older adults are at a higher risk for fractures and other life-threatening injuries from such accidents. Hoarding can create dangerous living environments and tripping situations, especially for this population. The third area is isolation and loneliness. People who hoard are typically withdrawn and isolated, many times due to embarrassment of others discovering that they are hoarders, or family and friends not wanting to visit them at their home due to unsanitary living conditions. In many cases, this hoarding behavior leads to social isolation, but on the other hand, some people may turn to the comfort of hoarding because they are lonely. The next area is the need to conserve. Many older adults grew up during the Great Depression, so they have an inclination to save things. This history and life experience is very important and must be looked at when considering older adults and hoarding behavior. The fifth area is history and memories. Sentimental value, particularly if a person is isolated from family, is very important. Many objects have meaning attached to them, and they're all that might be left of a person or a memory. Therefore, older adults, many of whom have a rich amount of experiences, may be inclined to keep a lot of different items in their house. The next area is stigma. Many older adults grew up in a time when counseling or seeing a psychiatrist meant you were crazy. There was a lot of taboo surrounding seeking counseling help and stigma attached to mental illness. Many older adults didn't even know that they had a problem. Therefore, older adults with hoarding behaviors may be less likely to seek help for this issue. Therefore, it is important that we look at a variety of community resources to help individuals seek the help they need. The next area is consumerism. eBay, dollar store, home shopping network, these are many areas that promote consumerism in our culture. Homebound older adults and those who are lonely and want to fill time and emptiness may turn to this buying spree. Therefore, we must look at this area as well when considering older adults and their tendencies to hoard. Last area is intergenerational issues. Hoarding is oftentimes intergenerational and passed down from one family member to another. Therefore, having a family member who is a hoarder is considered to be a risk factor. Older adults may actually pass down hoarding behaviors to other children, although this area needs further research. Hoarding also creates issues in terms of being able to sell a home or clean up the house appropriately. There are many expenses in regards to cleaning up hoarding mess. Therefore, there may be emotional cutoffs from other family members when the burden of taking care of a hoarder's home becomes too high. All of these areas are important to look at when considering older adults and hoarding. Since this area is not highly researched, it is important that we educate others on hoarding in the older adult population and that we work together to promote a helping environment for people in need.
Hi everyone, my name is Carol Schuler. I'll be talking about the 7 categories of hoarding. The first category is the effects on the family. Some of these effects include intergenerational, emotional, physical health, relationships, social aspects, and expenses and cleanup from a hoarder. Often it's been reported that family members tend to feel frustrated when family members who hoard items try to control decisions and the overall situation. Also, family members may feel financial stress towards the person who has a hoarding tendency. Relationship studies have shown that female family members report having more strained relationships with the hoarder than did male family members. Another category is the emotional and psychological toll on the individual. Some of these emotional and psychological tolls include embarrassment, shame, guilt, fear. A lot of times hoarding is something that family members try to cover up. They don't want to discuss with their friends or outside family members. It's something that they would like to hide from other people in society. Another psychological toll is anxiety, obsessive compulsive disorder, and depression. These are common diagnoses or mental health histories found in families who have a hoarder or also the hoarder themselves. There's also treatment options for hoarding, which can be expensive. Cognitive behavioral therapy is a common treatment, as well as group therapy and family therapy. A third category of hoarding includes triggers and risk factors. Some of these triggers include sentimental value of objects, access to home shopping network, repetitive buying from eBay, dollar stores, credit card purchases, and of objects that are just usually not used or packaged away in boxes sitting in the home, continue to build up clutter. Another trigger includes the death of a loved one, trauma, either severe illness in early life or during the later years, and also studies have shown a familial history of obsessive compulsive disorder as a possible trigger as well for hoarding. Some societal perspectives that in hoarding include the Great Depression. During this time, people were very poor, not well off financially, and continued to struggle. So just continuing to hold on to items of value over time may have been a reason for hoarding to occur in this generation of people, the baby boomer population. Just the availability of going to the dollar store to purchase items at cheap prices and to continue to build up these items. And before you know it, you have 10 of everything of a certain thing from the dollar store. There's some discussion about historical and cultural factors also, as well as international factors that can affect someone that is a hoarder as well. A fifth category of hoarding includes health and physical toll. There's the stress on the caregiver. A lot of times family members are just unsure of how to help a hoarder and how to get proper assistance from outside sources. There's safety related to falls and fire hazards due to clutter in the home. There's also an issue with sanitation, proper air quality and circulation. And also a lot of these older adults have COPD or asthma, and they may even have pet dander or pet issues due to hoarding of animals. A sixth category of hoarding includes monetary cost. Hoarding can be very expensive. A lot of people can go into debt for purchasing items repetitively or items that are just not of use. Insurance coverage can be high as well. Also, help with actually cleaning up a hoarder's home, and psychiatric issues and treatments they may need can actually be expensive as well. And just professional organizations that may come and help and assess a hoarder's home and how to best assist them, it can also be expensive as well. A final category of hoarding that I will discuss are the roots of hoarding. Some of these include sexual abuse, mental abuse, physical abuse, historical occurrences such as the Great Depression discussed earlier, and trauma. Hoarders have reported a significantly greater number of different types of trauma. They have more frequent traumatic experiences, more symptoms of inattention and hyperactivity. There's also a greater comfort level derived from their possessions and possessions in their home. These findings are consistent with previous reports in the literature.
Thank you for your attention. If you have any question or concern, please don't hesitate to shoot us an email at hoarding.pitt@gmail.com. Carol and Dana will be more than happy to answer your questions or direct you to the right person who may be helpful to you. Looking forward to hearing from you soon.